Healthcare involves a complicated mix of services, like referrals from one doc to another, the requisitioning of diagnostic imaging and referrals for specialized clinics like diabetes, mental health, addictions, hips and knees, and how about requests for long-term care, just to name a few. Let's think of these generically as just requests for services. As you've probably experienced yourself, today most of these referrals or requests are handwritten or printed and then sent by fax. The sender of the request usually sends the request to the same doc or site and doesn't have much information to base the decision on where to send each request, like wait times and other available options for the patient. Once she sends the request for her patient, she and the patient wait for a reply, sometimes for extended periods of time. Perhaps if she was able to quickly ask a specialist a clinical question, the referral could be avoided altogether, saving the healthcare system the expense and the patient the inconvenience. With almost 11 million Canadians seeing at least one specialist a year, the numbers quickly add up. The receivers of the requests often complain that the information they received was incomplete or the referral was inappropriate. Sometimes, with some additional information provided to the referring physician, the specialist appointment might have been avoided. Thankfully, things are beginning to change. With the Novari eRequest system, physicians can quickly and easily ask a specialist a clinical question. The eConsult feature is intuitive to use, and the clinical conversation between the two physicians can be attached to a subsequent referral, should one still be necessary. With Novari eRequest, the senders of the referrals have accurate and real-time information of the referral options for every type of request they make across the continuum of care. In the case of a referral from a GP to a surgeon, the referring doc knows how long it will take the patient to have his first specialist appointment. We call that Wait 1. He also knows how long it will likely take for his patient to have surgery if it's required. We call that Wait 2. He even gets a list of other surgeons in the area and their Wait 1 and Wait 2 times, so now has more options when making the referral. The same system can be used to manage any Wait 3 or post-acute care referrals, perhaps for complex continuing care, long-term care, rehabilitation, palliative care, and other services. Novari is the only eConsult and eReferral system that manages the complete patient journey, from initial referral to diagnostic imaging requisitions to the day of surgery and available post-acute care services. In other words, the only combined eConsult, eReferral, Wait 1, Wait 2, and Wait 3 system. Unlike in the paper world, the referring doc even knows in real time if the referral is appropriate, when the request is accepted by the receiver, when the patient is scheduled to be seen, and even the outcome of the appointment. No more waiting in the dark. For some healthcare services in some parts of the country, to improve the coordination of care, the routing of referrals is being managed with central intake, what queuing theory academics call a single point of entry system. The Novari eRequest system is customizable and flexible enough to flow requests through an intelligent central intake system where required, or directly from the requester to a specific receiver, clinic, hospital, or agency. It has taken some time, but the days of paper or fax referrals is quickly coming to an end. Novari eRequest is making the process better for referrers and receivers, which, if you think about it, means better care for patients. Novari eRequest.